Okay, preparation and immobilization of your. So what is needed to start an IV? Well, to start an IV, you will need a specific sterile supplies at the ready. So whatever your organization uses. Let's explore which of each of these items typically are and what they're used for. So you need an IV start kit, and it just depends on what your organization use. But the IV kit will contain some basic items that you will need to insert the IV. It usually has a tourniquet to help you locate the vein, antiseptic wipes to clean the IV site before inserting the needle, a needle gauge to pick the appropriate size, and an identification sticker to label the IV. It should usually have some gauzes, some tape, and a tegaderm. Labeling the IV is critical so other members of your patient's health care team know who placed the IV, when it was placed, and when or if a replacement IV should be administered. So the IV needle. The IV needle allows you to access your patient's vein. You use the needle to place the catheter, the plastic cannula in the vein, and then the needle is removed. And I can't wait to do this with you guys. So you also have to have at the ready your extension tubing or cap. Once the IV is in place, you will need the tubing to connect the IV to whatever fluid you're administering to the patient. If you're placing the IV to draw blood or for an upcoming procedure, then you're just going to cap off the IV to keep it sterile. You need a normal saline flush. Finally, you will need a saline flush that generally comes in a pre-filled syringe. The flush is used to ensure the line is clear and in working order before administering fluids. Now, how to set up an IV. This is a great time to prepare your patients for insertion mentally and emotionally. With your IV kit materials ready, you're going to open up the IV start kit and place materials within your reach, not across the patient, but on the side of you so you don't have to reach across the patient. You're going to draw up your saline flush unless it's a pre-filled syringe, and then you're going to have it ready. With the IV catheter connector, flush the extension tubing or cap. So you don't want any air in that line, so you're just going to flush that line. You're going to open the catheter package. Now you're ready for your proper IV insertion. So now, once you're prepared for what you need to insert your IV successfully, you need to figure out where you're going to put that IV. So areas with problems like edema or burns will not work. Look for clear skin, preferably where veins are visible, and the IV cannula will fit well. You can complete the process of starting the IV line after you have identified the IV site. There are benefits and drawbacks to each size. Larger IV options can administer the medicine faster, but tend to be more challenging to insert, cause more pain for the patient, and increase vein irritation. There are 5 main types of gauge sizes you need to know. Listed from largest to smallest is your 14 to 16 gauge. These are the largest options. You will not typically be using these, but you may need to use these in rare circumstances, such as to deliver fluid in a critical situations quickly. Your 18 gauge is the next step down and is still fairly large. This size generally only sees usage in emergency situations as well. A 20 gauge is generally the most common size on adults. It works in various situations, including blood return and lab work. While this option does not deliver medicines or fluids as fast as the larger gauges, it will suffice in most typical situations. Then a 22 gauge. This size is significantly smaller. This makes it a little bit of a better fit for pediatric patients and adults with fragile veins. This gauge generally does not suffice in situations where the patient needs a lot of fluids quickly. A 24 gauge IV, this is mainly designed for infants. This gauge size is extremely small and can be flimsy, therefore would not be usable on a large child or adult. So once you've determined the proper IV size you'll need, you can prepare your patient. You start by washing your hands and putting on a pair of clean gloves. Remember that you have a high risk of interacting with the patient's blood, so this is critical. Use the tourniquet on your patient's arm above the area of the insertion site. This is to help make the veins more visible. Look for a vein that is a straight that look for a vein that is straight and large. You can also palpate to feel around. Sometimes you can't see the veins, but you can feel them. Use your antiseptic swab. Often, it's usually chlorhexidine, as we discussed, or alcohol to clean the area thoroughly, and then allow it to dry. Do not wave the air over the insertion site to expedite the drying. Just let it air dry. After preparing your patient, you can begin to prepare the IV. So prepare your IV while your patient's arm or other area of the IV insertion dries from the disinfectant wipe. Begin by preparing your IV tubing. Hang the bag from something elevated and fill the tubing with the saline solution. Watch for any signs of bubbles in the IV line. Remove any bubbles to prevent an embolism in the patient. Now, there's always somebody's going to say there's a little bubble, there's champagne bubbles, but you need a lot of air to do damage. But you want to remove any air that is visible from the line. Open the IV and remove the needle cap. Twist the catheter hub to make sure it is loose and steady. Ensure the IV does not touch anything other than the patient's skin at the insertion site. You do not want to compromise the sterility of your instruments. Insert the IV needle. Once you have fully prepared your IV and have prepped your patient, the time has come to insert the IV. Hold the needle in your dominant hand at about a 10 to 30 degree angle. This should be from the arm or the area of insertion, and you should have the bevel up. With your non-dominant hand, hold the skin taut over the vein so it doesn't move as you try to insert the needle. When you have inserted the needle correctly, you will see a flashback of blood in the flash chamber. You might also see the flashback in the catheter depending on the size and type of catheter you are using. Once you see this flashback, decrease the angle of the needle until are nearly parallel with the skin. Then advance a few millimeters. After you've advanced the entire unit, advance only the IV catheter and slide it off the needle. It should slip in easily. If you see dimpling on the skin, you may have accidentally placed it in the extravascular space instead of intravenous. Carefully attempt the venipuncture again. Next, take the tourniquet and use your index finger to put pressure beyond the catheter tip. Removing the tourniquet helps ensure proper blood flow. Finally, press the activation button to retract the needle fully. With this, you have completed your IV insertion. Now it's time for the IV line. Now that you have the IV in place, secure it with the materials you had in your IV kit. You might use a dressing like Tegaderm or gauze and tape to hold the IV in place. If you have an extension loop, ensure the securement of this as well. Ensure nothing can easily get caught and pull the IV out. If the patient does not understand the importance of not pulling out the IV, such as a young child or a confused patient, you can wrap the IV area with Coban. It's important to leave the cap accessible if you do this. Removing an IV. Knowing how to remove an IV is just as important as placing one. Begin with gloves on. Carefully loosen the dressing around the insertion area. Then place the gauze over the insertion site. Pull out the IV cannula in one quick, smooth motion. Apply firm pressure for at least 2 minutes on the gauze over the insertion site. Without that firm pressure, blood seepage can occur.